Right, we are now a year into the pandemic, and for many, the longest year of our lives, even longer if you work in medicine, a hospital, or a clinic. Some of the leading doctors at Mayo are now looking back as to what we've learned about the virus and what we need to dramatically improve.
It has been a year of testing, isolating, sickness, and tragically death. We've learned a lot, and so has medicine.
Number one, antibodies are effective.
Dr. Andrew Badley is Mayo Clinic's COVID task force chair. He says one of the biggest discoveries is that antibody treatments from therapies such as convalescent plasma actually work. He also marvels at the rate at which medical science has been able to control the disease.
I grew up in the world of HIV, and in the world of HIV, to identify the virus, understand its molecular biology, test our first generation of agents, and come up with drugs that work a little bit, took a decade or so. That same process has occurred in less than a year for COVID.
And the fact that we now have vaccines in less than a year is historic.
I look very optimistically into the future because I do believe that we know much better how to keep people safe.
But at the same time, we've learned that a pandemic is more than a virus. It has upended society, and it's impacted people's overall health.
Cardiac outcomes, the stroke risk, and things like that, the screening tests that are not getting completed, and also the mental health consequences are so profound. So in many ways, it's more than just the virus itself, and we have to keep thinking about that as we go into the future.
But the biggest lesson is how it amplifies social disparities.
How profound it is that social inequity kills people, and it kills people. It's nothing short of that.
Now, Dr. Badley says going forward, we are going to continue to see new variants of the virus, and he says it will result in new cases, but he doesn't necessarily see this changing the trajectory of the pandemic.